Got diabetes or know a loved one with the disease? Well, getting the correct information about managing diabetes or even avoiding it is now more important than ever.
It is very much a burden in the community, and as we become relatively wealthier in our society and have a larger access to food and less access to activity, then the rates of diabetes has just skyrocketed in our country. And there are 27, I think there are about 27 million diabetics in the country right now. It's a lot.
In respect to diabetes, African Americans and Hispanics have a high rate of diabetes. Because of this high rate, endocrinologists, who people usually consider taking care of diabetes, are not going to be able to handle it. There's not enough not enough endocrinology physicians to do that. So internal medicine, family practice are going to have to step up and start taking care of more diabetics. I take care of diabetics a lot because it's a personal interest of mine, because of my family who has a lot of diabetes. Because of this, I see what happens in Hispanic and the African American communities. One of the things is we've got to have people actually coming into the doctor and checking themselves and not saying, oh, I'll go next time, I'll go next time. Because by the time they come in, a lot of times, damage has already been done.
That is why the American Diabetes Association recently held an event in a predominantly minority neighborhood, telling people they have the power to do something to help themselves.
I always tell everybody you don't die from diabetes, you die from the complications of it. And it's serious that you have to go out and get tested. You have to go out and take care of yourself, because my mother was a product of that. She passed away from complications of diabetes. And so that's why I'm so passionate about it.
Also, Jennifer speaks from personal experience. She was diagnosed with diabetes herself about a year ago and practices what she preaches.
Basically, what I do is I watch my carbohydrate intake. And basically, a carbohydrate is a sugar. And basically, that's how your body reacts to the food. And that's how you get an overload of sugars in your body. And so what I basically teach in my diabetes education classes is 1/4 of your plate should be your meat. 1/4 of your plate should be your carbohydrates, like your rice or your mashed potatoes and gravy, and then the other half should be vegetables. If you do that at your meal time, that is a complete meal for one that's diabetic. Because I try, whenever I go out, I make sure that I can relate to people and tell them I'm going through this struggle just like you are. And so if I can get them to see this is how you should eat your plate. You can still have that fried chicken, but just do it in moderation. You can still have those wonderful mashed potatoes with that gravy on top, but just do it in moderation. And that is the key: diet and exercise. And that is what has worked for me. I'm a living testimony that if you do that, you will see a difference.
And Dr. Shepard has his own personal story about diabetes that he uses to encourage his patients.
I use, as an example, my grandmother. She's 91. I don't think she'll be upset with me telling her age. And she's had diabetes for over 40 years. She has never had an amputation. She hasn't had a heart attack. She hasn't had a stroke. She doesn't have kidney problems, things that you see are complications. And it's because she takes care of her diabetes. She checks her blood sugar at least twice a day. She eats right for the most part. Every now and then she gets her. She has her little splurge, but she eats right. She takes her medication. She doesn't play with any of that. She still has her vision, so none of the complications that you see for diabetes she hasn't had. And it's because how well she takes care of her diabetes. So she's actually an inspiration for me when I talk to patients. I'm going, if my 91-year-old grandmother can do this, you can do this. You can check your sugar and it's not that bad. It hurts and all that sort of stuff. If she can do it, you can do it.
Diabetes.org is the American Diabetes Association website. You can also call 1-800-DIABETES for additional information.